All right, welcome back. Now we want to talk about CPR. Basically, CPR is trying to get oxygen to the body and pumping it to the vital body organs. And in the wake of COVID, there are few changes that we have made that are very important when taking care of somebody who is not breathing and you want to resuscitate them so that they can start breathing normally. So what do you do now that we have corona? The first thing that you need to do is you cover the casualty's face, covering the mouth area with a clean towel so that there is no infection between yourself and the casualty. And then where ordinarily we used to do rescue breaths, you cannot do rescue breaths now unless you want to get coronavirus. What you do is you continue with chest compressions at a rate slightly faster than a second hand. 1, 2, 3, 4, 5. You continue like that until 3 things happen. 1, an ambulance arrives. 2, you are so tired that you cannot continue. And even if that's the case, you can give somebody else or hand over so that they can continue with the compressions. 3, the scene has become so dangerous that when you continue, you will endanger yourself, endanger the life of the bystander, so you cannot continue with the CPR. But when it comes to children, the ball game changes. 1, because we are dealing with 2 risks, the risk of death and the risk of getting COVID-19. When a child stops breathing and you do not intervene within 4 minutes, that child is likely to die. But if you intervene and give CPR the way it is required, the child may not die, but may get coronavirus, or you yourself, you may get coronavirus. So which is the bigger risk, of getting coronavirus or of dying? Obviously, the risk of death is quite high. So you cannot leave the child to die. You can continue with the CPR and then you can seek treatments. Moreover, the chance of survival is over 80% if you get coronavirus. And for the child, it's almost nearing 100%. So gambling between the two, we recommend that you continue doing CPR the way it is required by starting with 5 rescue breaths, up to 5 times for the initial breaths, and then you follow it up with 30 chest compression. 30 chest compressions. 1, 2, 3, 4. You continue up to 30, and the second breath you resume to 2 breaths and not 5. So you continue with 2 rescue breaths followed by 30 chest compressions until an ambulance arrives, or you are too tired, of which you can hand over to somebody else to continue, or the scene becomes too dangerous and you're likely to die out of that danger. So that is all for today. Next time when we meet, we will be discussing serious matters, how to handle an accident scene where we have coronavirus. Thank you.